All right. Well, good afternoon, everyone, and welcome to this informational webinar on supplemental security income benefits and PA-ABLE, hosted by U.S. Senator Bob Casey's office, the Social Security Administration, and PA-ABLE. We're grateful for everyone taking the time to join this call today. I want to start by introducing myself and the other panelists on this call. My name's Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Abby LaForme. From the Senate Aging Committee, we have Allison Council joining us. From the Social Security Administration, we are excited to introduce Frank Magny, who is Social Security's Public Affairs Specialist. From PA-ABLE, we are excited to introduce Diana Fishlock, who is the PA Bureau of Consumer Programs Outreach Specialist. We're grateful for all our panelists' willingness to join our office for today's webinar. Before we get started, I'll quickly note that if you have any questions, please hold them until the end of the presentations, when we will have a Q&A session. We ask that you please keep your questions general and applicable to as many people as possible, since this is a public call. If you have questions regarding your own specific situation, contact information for Senator Casey's office will be provided during the presentation for you to reach out to directly. And at this time, I'm going to turn the call over to Frank with Social Security to delve more into the specifics.
Well, good afternoon. Thank you so much for bringing me on for the call today. Everybody in attendance, thank you for taking some interest into this topic. Supplemental securities income is a topic near and dear to my heart. Previous to this position, I'd worked 3 years with this program and have seen the impacts that it has made for many Pennsylvanians. It is pretty not as well known program as the Social Security, and outreach like this really helps us to get the message out in regard to this. So I always look forward to any opportunities that I have. So with that, we can go to the next slide, please. As a reminder, information that I discuss on the call today is basically subject to here, August of 2023. There are many updates to the Social Security Administration policies, and in certain cases, if I talk about monthly amounts or income or resource limits, those tend to vary from year to year. So if this presentation is being viewed in another year, the information might not correspond with what is currently taking place with the Social Security Administration. Next slide, please. Okay, so this image illustrates the number of beneficiaries we pay. Okay, so this is outside of even SSI. Currently, more than 1 in every 6 people in America is receiving Social Security benefits. So that's retirement, Social Security disability, and then, of course, SSI. And then the majority of our beneficiaries are retired, so most people are collecting benefits after age 62 with no involvement with disability. But Social Security is more than retirement. It is a family protection plan that assists over 12.4 million disabled individuals under age 65. And almost a third of these beneficiaries are disabled, dependents, or disabled or survivors. So these programs touch more lives than you might not know without doing further research into the subjects. We're obviously going to focus on to those 2 small slices up here, SSI of 5 million people, and then the both. And I'll get into the both because many individuals that do receive SSI might get a check from the Social Security Administration and then from the Supplemental Security Income program. So with that, next slide, please. Kind of a brief contrast of these 2 programs, as and then later in the presentation, I'm going to go more in depth with SSI, but it's always important to know that these 2 programs do work in conjunction with each other. When you file an application for disability benefits with Social Security, we always check your eligibility for both of our programs. The same medical requirements apply to both programs, but not the non-medical requirements, which I'll discuss during this presentation. Staff at your local Social Security field office review your non-medical eligibility, and if you meet the non-medical requirements for Social Security Disability, SSI, or both programs, we send your claims to the medical examiner who works for the state. So in Pennsylvania, this is known as the State Disability Determination Service. When you get letters from this agency, it's under the umbrella of PA Labor and Industry, and I'm going to talk a little more about that in later slides. Specifically, the medical examiners work for a state agency called the DDS. Once the medical examiner makes a medical decision on your application, you receive a notification by mail, and your local Social Security field office receives notification electronically. If your claim is approved, you will start receiving monthly disability benefits. If denied, you have a 60-day to file for an appeal, which I'll discuss here later in the call. Now, SSI is a federal income supplement program funded by general tax revenue, not Social Security taxes. Social Security administers the SSI program, which pays monthly benefits to adults with limited income and resources who are disabled, blind, or over the age of 65. Blind or disabled children may also get SSI. People who have worked long enough, recently enough, may be able to receive Social Security benefits such as disability or retirement and SSI benefits at the same time if the amount of the Social Security benefit in combination with other personal incomes fall below the SSI income limits. So on that previous slide, you saw that there was that chunk of 2.5 million people that might receive both of these benefits, and it does go to illustrate what the Supplemental Security Income Program is about. Additionally, any household with an individual who receives SSI may be eligible to receive discounted internet service through the Affordable Connectivity Program, or ACP. The ACP is run by the Federal Communications Commission, but not the Social Security Administration. And I will speak about this a little bit more as it relates to medical coverage. Also, SSI also corresponds with what we call Medicaid, which I'll discuss later in the presentation. Next slide, please. For individuals 65 years or older, no medical decision is required. Since a medical decision can currently take about 4 to 6 months, aged individuals can sometimes get benefits relatively quickly as it relates to supplemental security income. What is important to remember with SSI is it is essentially a month-to-month program. It provides benefits in months of limited income and resources and will reduce in months when maybe income and resources increase to certain levels. It's exactly for this reason that somebody who has been previously denied for SSI might qualify if changes take place within a household. Death within a family, divorce, separation, even a child moving into a new household can all be reasons to reapply for SSI eligibility. The final note on this slide does highlight that children must be disabled to be eligible, but have different rules in making that disability determination. Next slide, please. One of the key differences between child and adult disability comes down to capacity for work. Evaluating recent work is a critical step in determining disability for adults. One of the most common denials for both Social Security Disability and SSI surround this very issue. In my experience with the public, this is one of the more misunderstood aspects of applying for these benefits. After SSA verifies work at a certain level, claims can be immediately denied. In some cases, there's no disability decision made on the claim. In certain claims, if they are denied, it does not mean that a person does not have a disability. It just goes to the statements being made in this slide. So from that standpoint, can we go to that next slide, please? And these the statements that I'm talking about. Social Security's definition for disability comes down to not just the disability, but that disabilities and its involvement and the ability of an individual to work. Next slide, please. The key distinction between SSI and SSDI are these financial requirements attached to ineligibility. I'm going to go more in depth with each of these subjects, but this is the point that I'll be making throughout the presentation, that it is a month-to-month program, and basically all of these factors that you see on this slide right now can come into play in determining eligibility. So as I was trying to illustrate with work on the previous slide, I'll also illustrate with this slide, as far as SSI is concerned. A denial for SSI in some cases also does not mean an individual is not disabled. It does not. It would mean that they do not meet the financial requirements of the SSI program. So, in speaking with thousands of people through the years of working at a Social Security field office, I feel like that is one of the more misunderstood topics here. But one thing I would want to get across during this presentation is that SSI is disability in addition to these financial requirements. So, next slide for me, please. Okay. So as far as income is concerned, as it relates to supplemental security income, it's important to note that certain incomes are not deducted dollar for dollar from SSI benefits. Unearned income even has a $20 general exclusion. So on the right side, you see that the static benefits that come in each month probably remain about the same from year to year. They will reduce the SSI, but not dollar for dollar. There is that $20 general exclusion. On the left side, earned income has certain work incentives built in that allow individuals to work and get benefits. While you work and receive SSI, this is not a dollar for dollar reduction, and recipients might see, and in majority of the time do see, a net gain of household income by working and getting SSI at the same time. These computations, kind of go in more in depth, and they vary depending on circumstances. But I just like to mention, when I talk about income, is that there are work incentives built into these programs that allow an individual to get SSI, get income from these earned sources, and then, by and large, be able to have more income into their household. Back to that month-to-month theme again. In certain cases, if work increases to a certain level, benefits may increase or just basically stop during that certain month, but can reactivate for months when work decreases. So we're going to talk more about reporting. We're going to talk more about lots of other aspects of income and resources, but I really like to get across that the SSI records in many cases can stay active from a month-to-month basis, and with good reporting, an individual should not feel de-incentivized to maybe stop work or increase work for a specific month, thinking that the benefits are going to stop entirely and they have to go through the application process again. Next slide, please. As you can see at the bottom of this slide, there are resource limits. $2,000 for an individual, $3,000 for a couple. I try to not throw out those amounts because there's, with a lot of things as it relates to SSI, it does depend. But as you can see on this slide, ownership of these certain resources can determine SSI eligibility for an individual. With that in mind, there are certain exclusions, there's certain ways that we count things, so on and so forth. So looking at those final points is not, the finality, and a person that is well within these limits or might be close to these limits should still be encouraged to file for these benefits. I think it's going to be very, very beneficial, and I know Diana very well from PA Able because we've presented in conjunction with each other previously. But this is where PA Able and even special needs trusts can come into play as far as helping resources not be counted by supplemental security income. So for those of you that's interested in these programs, should definitely stay on to hear what Diana has to say, because this is also, PA Able is also a lifeline for individuals to conserve resources so that it does not affect SSI eligibility. Next slide, please. All right. As far as living arrangements are concerned, for purposes of supplemental security income, this is one of the factors that can determine how much a person receives in supplemental security income. if an individual is living in a household and they're receiving what we call in-kind support from individuals within that household, it can reduce the amount that an individual receives in SSI, as opposed to certain situations where a person is the sole provider within a household, or they are contributing their fair share of income within that household and contributing towards those. That all can play a role in how much a person receives in supplemental security income. This living arrangement portion is another, misunderstood and kind of contentious aspect for a lot of beneficiaries, but it also illustrates how much SSI can vary from person to person, place to place. That second bullet here, an individual and institution might only receive $30 per month. Individuals within a personal care home might receive more. So from that standpoint, we always illustrate that this program, as you're already kind of getting accustomed to, is very extensive and counts many different aspects of an individual's life, up to and including what we call living arrangements. Next slide, please. As you could probably guess, those getting SSI are sometimes in contact with the office almost every month. In some cases, reporting certain changes can be done via our website, ssa.gov, but throughout the application process, which I'll talk about here in just a few more slides, it is laid out for individuals, and reporting responsibilities are clearly identified for individuals. If you know somebody that's getting SSI, it's always good to encourage an individual being in contact with their field office as often as possible. When in doubt, reach out to the field office to make sure that any changes that are taking place within an individual's lives are if they do affect SSI, are being reported, or knowing that in a lot of cases those changes can potentially affect eligibility for supplemental security income. Next slide, please. This is a more extensive list in which individuals getting supplemental security income have to report as soon as possible. As you can see, some of the more notable or more unknown parts of when to report changes to us: if an individual is leaving the country, is outside of the country for 30 or more days, the SSI might stop for those types of scenarios. We only pay SSI to individuals living in the United States. But just as I was kind of illustrating with earned income or other types of situations, because SSI is a month-to-month program, in many cases, if a person's back within 1 year, they still would have a active SSI record to come back to, and do not have to restart the process. They just merely have to show us the time of duration that they were outside of the country, and then we can many times turn the benefits back on when they get back into a situation in which they're eligible. Other scenarios that tend to get overlooked: if an individual does get married, we need that reported. The income and resources of a spouse can determine eligibility for supplemental security income, and changes in household, not just moving, but in the cases of disabled children, or even for adults, people coming and going out of the household, all can play a role in eligibility for SSI. Next slide, please. Okay. If you do have an outstanding warrant for your arrest, you must tell us that you have an outstanding warrant for arrest. This is one of the qualifiers for supplemental security income. If you're convicted of a fraud crime, you have to tell Social Security right away. Regular disability benefits or underpayments that are due are not paid to a person who is confined for a crime, but any family members who are eligible for benefits based off the person's work may continue to receive benefits. This kind of goes back to Social Security benefits and auxiliaries that are paid off of those records. Monthly benefits of any underpayments that may be due are usually not paid to someone who commits a crime and is confined to an institution by the court due to court order. And then individuals who violate conditions of parole or probation, they must also report that to the Social Security Administration. So from that standpoint, this is one of the qualifiers, and I think it's reassuring for a lot of individuals, that do care deeply about how taxpayer dollars are spent. But this is a qualifier for supplemental security income. Next slide, please. Okay. So as far as SSI for children, um, an individual may be eligible beginning as early as the date of birth until age 18. And I talked about previously, there's different disability rules that do take place. When the child reaches age 18, impairments are evaluated based off of the definition of adult disability. But for children, um, we tend to see this as a group, especially as we've come out of the pandemic, that might be the most underserved by the supplemental security income. We find that this might be the largest group of individuals that might be eligible, that might not be getting benefits. And for those reasons, we've done a lot of outreach, in the past few years to increase awareness of these types of programs. For children, um, uh, there is still a disability determination that is attached to those. But the nice part with children, especially as we get back to normal post-pandemic now, medical information can come from multiple different sources. It just doesn't have to come from doctors, hospitals. For children, we have our intermediate units, we have early interventions, we have other social workers that work with children. All of those places can provide medical information to make a determination on whether or not a child qualifies for SSI. Next slide, please. Okay. Um, and it is with this that the process can take a little bit longer, as opposed to a person that's maybe over 65 that gets SSI right away. The process does take about 4 to 6 months, but we are going to look at the full range of medical conditions as it relates to a child, and you'll find that many individuals, many disabilities as it relates to children are probably not ones that because disabilities do run the gamut so much, certain types of developmental disorders, certain types of learning disabilities, the qualifiers for a child are very wide ranging. So for that reason, many individuals that might have children getting services within their schools and do have limited income and resources should be encouraged to potentially qualify to see if their child does qualify for supplemental security income benefits. Next slide, please. Okay. How income and resources are counted for children vary greatly. I mean, they vary greatly for adults, but as far as children are concerned, parents, we're going to talk about on the next slide, but children living with family members might not count the income of other individuals in the household. And this is something I'll probably refer back to on a few different occasions, but with my theme that SSI is a month-to-month program, and with my theme that individuals that might have previously been denied for these benefits, potentially for financial reasons, might want to check back in with us if certain large changes do take place, if certain parents leave a household, or if a child goes and lives in the household of another individual. These are times in which individuals should potentially, and of course, this would be children that would have disabilities, should check and file for benefits to see if they are eligible. But as you can see at the bottom of this slide, certain income, just like with adults, can offset the amount that an individual does receive for supplemental security income, and that would include child support and Social Security auxiliary benefits. Next slide, please. All right. So as far as deeming is concerned, that's basically a Social Security term, and what takes place with parents and adoptive parents within a household, their income and resources would affect a child's eligibility for benefits. However, I think a lot of people would be surprised at these income and resource limits as they relate to what we call deeming. So, parents within the household that even work can sometimes still receive supplemental security income. And earlier in the presentation, when I was talking about earned income, I was basically talking about earned income as it related to an adult. As far as children are concerned, in my experience, the households, depending on how many children are within the household, or depending on, once again, the types of income, individuals can make, relatively a good amount of money and still qualify for these types of benefits. So for those reasons, we do always encourage, once again, children with disability, there shouldn't be an assumption that maybe two parents working in a household would preclude an individual from getting supplemental security income. We would encourage people to apply to see. We do have those initial claims in which those financial questions are our main driver during those initial claims. As I talked about previously, a person might not even get a medical decision because we find them not to be financially eligible throughout that. But that is the function of your local Social Security office, your Social Security field offices, is finding eligibility for individuals, for all individuals that be eligible for all of our programs. So when in doubt, for a family of disabled children, please apply and see if you could potentially be eligible for these benefits. These benefits pay up to $914 per month and are key lifeline for a lot of families within Pennsylvania. So for all those reasons, don't always assume that you might not be eligible for benefits. Don't compare yourself to other people, other households that may have just been previously denied or might be getting benefits, but then you're denied. It's just always important that we just look at every case by case, to make that as determinations. Next slide, please. Age 18 is a very, very key time as far as supplemental security income is concerned for individuals in which parents' income and resources might have made them ineligible. When an individual does turn age 18, the income and resources of the parents then drop away. So we'll just be looking strictly at the income and resources of that individual. And so age 18 is a key point in which individuals with disability might apply for SSI for the first time, or might apply for SSI for the first time and then be eligible because of those key distinctions of how we count the income and resources of the parents as far as eligibility for supplemental security income. In addition to that, turning 18 is also a key time in which an individual would be evaluated for disability according to our adult rules. So individuals in some cases that are receiving benefits at age 18 might be denied at this point. And should be aware that certain disabilities that we deem children to be eligible for SSI might not in turn make them eligible for SSI as an adult. There are extensive appeals processes that come involved with these types of situations, and I'm going to talk about those more here in just a few more slides. But for those of you that might have a child that's coming up to age 18, or maybe a family getting SSI, it's always important to kind of note this key time as it relates to getting these types of benefits. In addition to that, it's also a time in which the field office is going to be in pretty much constant contact. There is those medical continuing disability reviews, which I had referred to previously, but there's also the financial reviews that the Social Security field offices conduct with each individual. And in the cases of a child turning age 18, those are probably one of the more key financial evaluations that we conduct. We're looking at a range of topics such as representative payee, as I spoke about previously, living arrangement, how much a person might be contributing within the household. So, back to a good rule of guide, individuals that are turning age 18 will have a lot of contact with the field office. Next slide, please. In general, foster children that are within kind of a foster situation are getting incomes from other different sources. But if they are leaving those types of situations, we do highly encourage them to apply for supplemental security income. So basically, in those cases in which foster income might be dropping away, those are key times in which a person should be encouraged to apply for supplemental security income if they have a disability and are losing certain forms of income as it relates to foster care. Next slide, please. As far as SSI and homelessness is concerned, adults or even children that do meet those medical requirements still do receive supplemental security income, even if they are homeless. This is also a key lifeline, and this is a larger segment of our population and illustrates, sometimes back to that month to month or even year to year type of theme as far as it relates to SSI. This program might be that key lifeline for individuals during those times in which they have the least amount of income and resources. And of course, that does apply to our homeless population. Next slide, please. For adults, most of the application process can be done online. It is very easy. It's been in place for many, many years now. Some people do find it more comfortable to complete these applications at home over their own computer systems or a family's computer systems, because it allows and gives them time to gather medical information for that process, or come to a question that they might need an answer to, and allows them time to research and find those answers to include with the application. So starting the process of filing for SSI as an adult, and I'm going to talk a little bit more about just even a referral for SSI and here in just a moment, can be done for the most part online. Now, what doesn't take place is that the full adjudication is not just done by machines. These applications, just like if the application is filed in our office, are evaluated by local technicians within the field office. If there are any problems with the application, we would reach out to an individual to find any type of discrepancies and correct those. The other key factor as far as applying for online, whether it be for Social Security, Disability, or SSI, I mentioned earlier in the presentation that this is a key part of these applications in which we are always evaluating which program you might potentially be eligible for. But the other part that's nice, if you start the process online, you can bypass the 30 to 45 days that sometimes comes into play in waiting for an appointment. Next slide, please. For individuals under the age of 18, an appointment does have to be made with the field office. We do have a referral system I'm going to talk about here in just a moment, but people can do certain portions of the claim online. You can see here at the bottom bullet that SSA.gov Child Disability Report. Once again, from the comfort of your own home, you can gather all the medical contact information as far as doctors, hospital, health agencies. What I had referenced earlier. The intermediate units that support schools within the state, IUPs. So by doing this disability report, it does allow all that information to be kind of done within the comfort of your own home and in the times versus having the appointment, which normally takes about 45 minutes to an hour. And during that time frame can be a bit packed. But from those standpoints, an individual, a child, will be working with a local field office representative throughout the application process in order to find eligibility for benefits. And there's very good lines of communications that take place during this application process. A technician can, basically explain the financial elements of why an individual might not be eligible. But then in the cases of disability determination, we also do follow up with individuals after that 4 to 6 month time frame to talk more about the programs, to talk more about reporting responsibilities and all the different ways that income and resources can affect benefits. Next slide, please. So when a application is filed, as I mentioned previously, it takes about 4 to 6 months. In general, even with adults or children, if an individual is approved and it's a supplemental security income application, not only will there be that initial application that takes place, but there will also be a follow-up appointment that more than likely will take place with the local field office. So for individuals that do get those are notified by mail that they are approved for benefits, they should be looking out for notifications from the offices of the follow-up appointment. The other thing I like to mention during this slide is that even during that disability process, in times in which there are limited medical evaluations or limited medical evidence to evaluate, that Department of Labor and Industry, the PA Disability Determination Service, might also reach out to you and schedule an appointment with a contracted doctor for Social Security in order to gather more evidence in times in which enough evidence might not be available. Next slide, please. Very, very important to note, because this is also a pocket of individuals that might qualify for SSI that might not be aware of it. For many of you that live within the state of Pennsylvania, I'm very proud to know that we are a major hub of parolee and refugee resettlements in Lancaster and Erie specifically. I'm from Lancaster and worked in the Lancaster office. These places have many different types of resettlement organizations, and once again, something I'm very proud of, that the state of Pennsylvania is a place in which many non-citizens might come for their first time coming into the states, and then these individuals in certain cases might be eligible for supplemental security income. Next slide, please. These next two slides kind of go over the different types of qualified aliens. There's been a lot of kind of change. This is why I talked about the disclaimer at the beginning of this call. What's outlined here might change from year to year, but what has taken place recently with Ukrainians, Afghans, certain Central American populations of parolees coming into there, these individuals are becoming more and more eligible for supplemental security income. Next slide, please. I talked about refugees being admitted, individuals being granted asylum. So if you are, maybe part of a church organization, or you come in contact with these populations, they should be encouraged. Once again, for adults that might have a medical disability, and for any individuals that are 65 years or older, as I talked about before, they do not need a medical eligibility. It just comes down to their income and resources, and more than likely, they might qualify for benefits even if they are a qualified alien. Next slide, please. So some of the qualifiers are listed on this slide here. In certain cases, those quarters of coverage that are related to Social Security eligibility can sometimes relate to if a person does qualify for SSI. But as I've been trying to illustrate throughout this presentation, some people just assume that they're not eligible for certain types of benefits, and it might be the case. But from that standpoint, this population of qualified aliens should see if they have potential eligibility, and in lines with that, do have to basically have their documentation at the time, even if they had previously gotten a Social Security card. The SSI application process is another time in which we do verify their immigration status, but this is a pocket of individuals that we do see underrepresented sometimes as it relates to SSI eligibility, and we do encourage applications from this population as much as possible. Next slide, please. And then, as you can see, these are a list of the documents that an individual should keep and should safeguard and keep, but will have to be used throughout the application process. So if you are encouraging an individual to qualify for benefits or apply for benefits, these are types of forms that we would need to see. And we would go through the process much like we did when we issued a Social Security card, in which we are validating their permanent resident status in order to determine SSI eligibility. As I just talked about recently, there is a big pocket of individuals that are 65 years or older coming into the country as refugees or parolees. When it comes to these types of individuals, this step right here can be the process that delays benefits being paid as long as possible. So if a person does set up an appointment for SSI, we do recommend that they have all of their immigration documents available for those first appointments. Even though the appointment's done over the telephone, after the telephone appointment, the person will set up a time to come into the field office to present these documents. And the faster they do so might potentially be the faster that they get supplemental security income. Next slide, please. So after that 4 to 6 month process, I've talked a little bit more. I've talked about these steps a little bit so far. We do, the state agency makes the determination. They contact us electronically, the Social Security offices. They contact an individual by mail. But more times than not, an individual will have a follow-up appointment with the field office. And what we do during those appointments is we look at those financial eligibility factors during those 4 to 6 months. Even an individual that might be receiving Social Security benefits, because the Social Security disability program has a 5-month waiting period, might qualify for supplemental security income during those timeframes. So those individuals that are going through that application process and do get that approval in the mail should know that benefits in general don't come within the next few days or the next few weeks. There are processes that take place after the fact so that we can make sure that we're paying the correct amount in benefits. Next slide, please. As I mentioned previously, individuals might go through that 4 to 6 month process, and they might find that they're denied. In many cases, and you will find this if you speak to individuals that are getting benefits right now, you might have to go through a certain levels of appeals in order to maybe be approved for these types of benefits. And in that, I do highly encourage an individual to pursue the appeals process. Next slide, please. And these are this does outline the different appeals levels that individuals will undergo. But as I stated, from an anecdotal type of thing, you'll find for some individuals that might have multiple disabilities, or for some individuals that have disabilities that are acutely getting worse over periods of time. As far as those situations are concerned, appeal might be the right step for you, especially if you have a disability that is preventing you from working. That first initial decision shouldn't necessarily be the ultimate decider that you're not getting these types of benefits. I'll bring your attention to the number 2 bullet on this slide, the hearing by an administrative law judge. Many people find that they have to get to this level of appeal to potentially get a more expansive evaluation of their record. And I do encourage any individual that might have applied for benefits throughout their lifetimes. And I commonly see this when I worked in the field office, in which a person might apply at the initial level, be denied, wait a few years, apply again, be denied at the initial level. For these individuals that know that they have a disability that is preventing them from working, instead of waiting, or just applying initially, they should be highly encouraged to go through this appeals process, because for certain individuals, they have to go to these appeals levels in order for their disability to be defined well enough to determine whether or not they're eligible for benefits. Next slide, please. Even individuals that might have gotten a denial. So maybe you come in contact with an individual that says, oh, I was denied. There are good cause factors. So even if we are beyond 60 days of those denials, a person can still potentially file for an appeal. The reason I like to mention that right now is just basically those examples that I gave you previously, in which a person would apply at the initial level, then wait a period of time, apply again at the initial level. For these types of individuals, pursuing an appeal is sometimes the better course of action to be approved for benefits. And even if they're past 60 days, next slide, and we'll talk about those factors of good cause. If any of these situations do exist, which they do commonly do when it comes to individuals with disability, we might be able to continue that process. They might have to file for benefits, for the first time again, and initially again. That if these good cause factors do come into play, then even after that 60-day time frame, we may potentially be able to continue an application. And the other implication there is that applications are paid retroactively. So the other good part of this, even though it does take so long in certain cases to be approved for benefits, benefits are paid retroactive back to the point in which they first started applying for benefits. And in so doing, by continuing their claim with an appeal, they might eventually be eligible for more benefits retroactively. Next slide, please. The other part, because for the past 3 slides, we were basically talking about situations that involve medical decisions. But there are other denials that do take place, as this slide does illustrate. And I had talked about in an example earlier in this presentation. During that initial claim, a person might have been found to be ineligible, and they might not have even been determined medically eligible because we might have found that based off of their income and resources, their living arrangements. There are also appeals in those types of matters in which maybe potentially factors had changed. There might have been a misunderstanding between you and the technician, but there are appeals as it relates to if a claim was denied for financial reasons or living arrangement reasons and things of that sort. And individuals, once again, because of the retroactive nature of the benefits, should potentially be encouraged to file these appeals if there was some type of misunderstanding throughout that application process. Next slide, please. I had alluded to this earlier. Due to the fact that we saw such a decrease of SSI applications throughout the pandemic, we do have a very easy tool for individuals that just basically want to see if they are eligible for SSI. And once again, from the month to month or year to year type of example that I've been giving throughout the presentation, this just makes it easy to kind of get that hold on your benefit, that hold on your application. Starting the process at this web link allows a person, this is what we call, obviously, the SSI online protected filing tool. As I alluded to, over these last previous slides, the day that a person goes onto our website and asks for SSI to be evaluated for supplemental security income, we could potentially go back to that date in which you click there to be eligible for benefits. So even if the application can take a month, 2 months to even get the appointment, once again, that first point in which you come in contact with our agency can be the point in which we can start paying benefits. And this online tool is very helpful as far as that's concerned. Next slide, please. From that standpoint, it's about 8 to 10 steps there on our online tool. But what takes place as a result of asking, saying I would like to apply online for SSI, the field office will follow back up with you. Now, this is different than just applying online for Social Security benefits. What this is I want to apply for SSI benefits. You might, even though it's done online, it's not that online application process. And when you use this online protected filing tool, the field office will follow back up with you within a few weeks and schedule an appointment for you. But once again, it's very nice that you can, for example, if you're meeting with a qualified alien or you're meeting with an aged individual that might have very limited income, this is your way of starting that process for them. They'll be later contacted by mail, but the eligibility can start when this this online protected filing tool is completed. Next slide. Just a quick note as far as Medicare and Medicaid, these two terms in some cases are interchanged and are synonymous with each other, but it's important to note that Medicare is the federal health insurance program for people 65 years or older, people getting disability benefits for 24 months. Medicaid, and this is becoming very much back in vogue since the emergency declaration for the pandemic has ended. Medicaid is basically insurance that's provided to individuals through the state. And it is different from Medicare. You get different cards, different types of coverages, so on and so forth. But what I'd like to note and why I include this slide on my presentation is Medicaid is automatically given to individuals that receive supplemental security income. So what is nice about getting SSI, and if a person is eligible for SSI, as long as they're eligible for SSI, they're eligible for Medicaid. The state basically lends the trust to the Social Security office to make those determinations. And when a person is getting SSI, they need only to communicate with the Social Security office as far as eligibility is concerned. And then they don't have those periodic reviews with the state as far as Medicaid is concerned. But I always like to make that distinction and like to let people know. In addition to potential free internet, SSI can be related to healthcare coverage. Next slide. Lots of news always takes place as far as Social Security is concerned as we go into the fall. The big news is going to be possible cost of living increases, possible amounts that we'll be paying for for Medicare premiums, all the biggies as it relates. And for those of you that are interested in those types of situations, Social Security is available at most of your social media sources. And finally, the final slide here. we're going to go to PA Able. I am going to stay available for questions and answers after the entirety of the presentation. But once again, thank you everybody that took the time to listen to my presentation today. As you can tell, this is a program I'm pretty passionate about, and getting the word out about it is could be very key for certain Pennsylvanians, and please for those reasons, please encourage individuals to get in touch with their local field offices. Thank you so much and have a wonderful day.
Thanks, Frank. All right, we're going to turn it over to you, Diana.
Hi, can you hear me?
Yep, we can hear you now.
Oh, good. Next slide, please. Thanks. I'm just going to give you a quick overview of ABLE. I'm Diana Fishlock, and I work for the State Treasury Department in Pennsylvania, and I'm also the mom of 2 individuals with disabilities, so we have ABLE accounts at our house too. Next slide, please. I'll talk a little bit about what ABLE is, who is eligible, and how to open and manage an account. Next slide. So an ABLE account is a savings and investment product for people with disabilities to use for qualified disability expenses. One of the most significant features of ABLE is that funds in the account are not counted when determining eligibility for federal means tested benefits, with some limitation for supplemental security income. Also, the savings get great federal and state tax advantages. Next slide, please. Through ABLE for the first time, many individuals with disabilities can save for a more secure future and have the ability to control their own funds. PA ABLE gives a number of investment options to the person managing the account, and funds in the ABLE account can be used for a wide variety of expenses. Next slide, please. ABLE stands for Achieving a Better Life Experience. Many states have ABLE programs. Pennsylvania's has been one of the fastest growing in the country, has a proven track record, and more than 7,700 account owners in Pennsylvania have saved more than $90 million. We're very proud of that. Next slide, please. As I mentioned, with an ABLE account, you can save while maintaining government benefits. The federal law says that assets in an ABLE account and qualified withdrawals from the account are not counted in any federal means tested benefits, with a limitation for SSI. Also, Pennsylvania ABLE are not counted against, Pennsylvania ABLE assets are not counted against Pennsylvania needs-based benefits having to do with disability, health, and student financial aid. This is extremely important because without ABLE, it was very limited how much individuals could save and still receive important benefits. Next slide, please. For example, traditionally SSI recipients could only save $2,000 in assets without jeopardizing that benefit. Now, in addition to that $2,000, they can save up to $100,000 in an ABLE account, which can make a huge difference, giving a person the ability to save for a house or a car or just everyday expenses. If they go above that $100,000 threshold, SSI benefits will be suspended but not terminated. And ABLE account owners who don't receive SSI can save more than $500,000 in their ABLE account. Next slide, please. An individual can have only one ABLE account nationwide. While you may see information from other states, Pennsylvania's ABLE law has several Pennsylvania-specific benefits that are only available to Pennsylvanians if they use the PA ABLE program. Some states have kind of confusing marketing initiatives, but if you go to the website paable.gov, then you'll know you're in the right place. Also, I'm going to give you just a quick overview today, but if you're interested in finding out more, there's lots of good information on our website, and you can sign up for a longer webinar that will be August 2nd. Next slide, please. So let's talk a little bit about some of the tax benefits of Pennsylvania ABLE. Contributions to PA ABLE are eligible for both state and federal tax benefits. Contributions to a PA ABLE may be deducted from state taxable income up to $17,000 per person per year. Again, only contributions to the Pennsylvania ABLE qualify for the Pennsylvania state income tax deduction. Also, there's no state or federal income tax on PA ABLE account earnings while the funds are in the account or when they're withdrawn if they're used for qualified disability expenses. Next slide, please. Eligibility depends on two factors. One is the age of onset of the disability, and the second is the severity of the disability. So the qualifying disability must occur before the individual's 26th birthday. It doesn't matter what age the person is now or what age they received the correct diagnosis. So I could be 100 years old today and I could still qualify for ABLE if my disability started before my 26th birthday. The second factor is the disability itself. So if the individual is eligible to receive SSI or SSDI, they automatically qualify for ABLE. But there is another option for people, and that is self-certification. Next slide, please. So with self-certification, in addition to the onset being by age 26, the person with the disability must have a written disability-related diagnosis from a physician who meets Social Security Administration criteria, saying that the person has a physical or mental impairment that results in marked and severe functional limitation and is expected to last for at least 12 months. Next slide, please. Most people find that the easiest way to open an account is online. You can go to paable.gov and click on enroll. Completing that process takes about 15 minutes, and it's a lot like applying for an online bank account or credit card. In Pennsylvania, we also give people the option to fill out a paper application. You can print that from our website, or you can call 855-529-ABLE and request a paper application, which we will mail to your house. There are some unique features on account control, and these rules were recently updated. So adults with the legal capacity to enter into a contract may open the account for themselves, or they may appoint any other person of their choosing to open and manage the account on their behalf. If the person with the disability is younger than 18 or lacks the legal capacity, then their ABLE account must be opened by another person. And that person is called the authorized individual. The federal government recently prioritized and expanded the list of who could be an authorized individual in this order: power of attorney, legal guardian or conservator, spouse, parent, sibling, grandparent, or Social Security Administration representative payee. So if an account is managed by another person, the person with the disability always remains the account owner. Next slide, please. There are lots of ways to contribute to an ABLE account. Anyone at all can contribute. You can use a check, money order. You can link your payroll to an ABLE account, and you can link a bank account to an ABLE account. So it's very easy to put funds in the account. Individuals receiving SSI or SSDI can also put them into their ABLE account as a direct deposit. The only people who cannot do that are people with a representative payee. This year, an ABLE account can receive up to $17,000, and I'll talk about an exception to that in just a moment. Next slide, please. Okay, the Able to Work Act adds some wonderful flexibility for some account owners who are working, allowing them to contribute up to $30,590 this calendar year. So basically, it's to qualify, a person must be working, and they must not have made contributions during this tax year to a defined contribution plan like a 401k, an annuity contract, or a deferred compensation plan. Next slide, please. Okay. Real quickly, we have 7 investment options. The 6 you see on this slide are asset allocation options. They are a mix of stocks and bonds and cash. They range from conservative to aggressive. Next slide, please. We also have a checking account. It is through Fifth Third Bank NA, but account owners would enroll in ABLE checking via our website or paper application, just like they would with the other investment options. The checking account comes with a free debit card that is free to use at an in-network machine, or $2.75 at an out-of-network machine. Next slide. ABLE accounts in Pennsylvania are free to open. There is an account maintenance fee regardless of what investments you choose. That's $14.50 quarterly if you receive postal delivery. Then it bumps down to $8.25 quarterly if you get e-delivery. Those portfolios have an asset-based fee. Those are nice and low. They're less than 1%. They range from 0.3 to 0.33% annually. The checking account also has a $2 per month fee, but there's 2 ways to get around that. One, if you have an average monthly balance of at least $250 in the checking account, or if you agree to receive your information electronically rather than through the mail. Either way, it gets rid of that fee. Next slide, please. If you need to take out money from those investment options, you can do so by logging into your account, by calling our ABLE line and requesting that we send a check to someone, or in writing by filling out a form. If you have that checking account option, you have some added flexibility to remove money from that. You can use your debit card at a store, at an ATM to make a cash withdrawal, or you can write a check if you want to purchase checks. Next slide. This slide talks about what an ABLE account can be used for. And the quick answer is almost anything. It's your money and you can use it for whatever you want. But if you want to enjoy the full benefits and protections of the ABLE law, you should use it for qualified disability expenses. Luckily, those are very broad. The federal law lists the 11 categories shown on this slide, things like education, transportation, prevention, and wellness. It's also fine to use ABLE for basic living expenses. Expenses do not need to be medically necessary. So it's very broad, and it's up to the account owner or the person managing the account to make the decision on what is qualified. They don't have to check with the IRS or the Treasury Department. But we do encourage people to save their receipts just in case they're ever audited by the IRS. Next slide, please. I'm going to skip over this one just for time's sake. Real quickly, I'm going to go over some of the rules that only apply for people receiving SSI. People receiving SSI want to keep their ABLE account under $100,000. Otherwise, it will be counted as an asset by Social Security Administration. In that case, their SSI benefits would be suspended but not terminated. They would not have to reapply, and it would not affect their medical assistance eligibility. So they would still be able to see the doctor and receive their prescriptions. Next slide. Also, with housing, anyone receiving SSI would want to pay their housing in the same month that they remove the money from the ABLE account. So if my rent was due August 1st, I would take the money out now in July, and I would pay my landlord or landlady in July rather than carrying that money over from July into August. Next slide. Next slide after that, please. And next slide after that. Okay, so that was our quick overview today. If you have more questions, I'll stay here to answer questions. Also, you can go to paable.gov, our website, or you can call us at 855-529-2253. Next slide. So we'll just leave that up there for a minute, and I will pass the baton.
Great. Thank you so much, Diana, for that information. And now we will turn it over to Allison, who's from the U.S. Senate Special Committee on Aging.
Thanks, Andrea. I am Allison Council. I work for Senator Casey as his Aging and Economic Policy Director on the Aging Committee. So I'm going to provide a brief overview of what the committee offers for constituents. As you may know, Senator Casey is the chairman of the Special Committee on Aging, which advances policy on behalf of older adults and people with disabilities. In addition to the Senator's DC and Pennsylvania office staff, we like to serve as a resource for constituents. Right now, we're in the process of arranging a hearing to discuss Social Security benefit delivery and the policies that Senator Casey can advance to strengthen and preserve Social Security for years to come. The hearing will be in state in Altoona, Pennsylvania on August 17th, and we encourage anyone interested in the topic to attend, so stay tuned for more information. The Aging Committee has also developed financial literacy and retirement planning guides for Pennsylvanians and materials to support constituents who may be targeted by frauds and scams, including Social Security related scams. Our resources are available in English and Spanish and are available for distribution through our office, so please reach out if you are interested. The committee also operates a fraud hotline to direct individuals who have experienced a scam towards local, state, and federal assistance and resources. Our hotline is answered by a live caller, one of our staffers, from 9 to 5 p.m. Eastern Standard Time, Monday through Friday. Out of those times, we have a voicemail inbox that is monitored, and we will get back to anybody who leaves a voicemail. You can call the general line for the Aging Committee at 202-224-5364, and the fraud hotline is available at 855-303-9470. Please do not hesitate to reach out to me or any of our staff, as well as the fraud hotline, our general line, if you have questions about Social Security, financial literacy, or anything else related to policy here. Thanks, Andrea.
Great. Thank you so much, Allison. So now I'm going to quickly cover how our Office of Constituent Services can help constituents. Let's go ahead to the next slide. So Senator Casey's Office of Constituent Services consists of a team of advocates who assist constituents who are having an issue with a federal agency. So for example, Social Security benefit issues, a missing passport, an IRS problem, and many more. So after we receive your written permission, our office is able to follow up with the federal agency on your behalf to check on the status of pending claims or appeals, ask a question, relay information or concerns, as well as demonstrate Senator Casey's interest in the case. It's important to note that under the laws and rules of the U.S. Senate, we cannot force a federal agency to act in someone's favor. Go ahead to the next slide. With regards to supplemental security income, we can reach out to Social Security on your behalf to try to to try and assist with a variety of matters, including claims or appeal statuses, income and asset limit questions, and overpayments. We can also assist constituents navigating the different programs within the Social Security Administration, such as Social Security retirement, spousal and survivor benefits, Social Security disability, and Medicare Parts A and B enrollment. The most common Social Security cases include Social Security disability appeals or back pay, replacement Social Security cards, questions regarding status of retirement claims, overpayments, and Medicare enrollment questions. Go ahead to the next slide. So if you specifically need assistance from Senator Casey's office with constituent services, either with an issue with Social Security or another issue with a federal agency, you can contact us using the information on the screen. And with that, I will now open this portion of the presentation for questions for Social Security, PA Able, or Senator Casey's office. If you have a question, you can click the raise hand button at the bottom of the participants list to indicate that you have a question. I will call on that participant that has questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you have a specific issue, please feel free to contact us via the information currently on the screen. And also, this webinar is being recorded, and we will share the recording with everyone who registered within a week or two. All right, so let me see here. Edna Richardson. Let's see here. You should be able to unmute yourself and go ahead and ask your question.
Question about the PA Able. Can you put your SSI or SSDI check, like direct deposited in there, or make transfers in there? And then what happens to the funds if you pass away?
Okay, those are great questions. Yes, you can direct deposit SSI or SSDI into a PA Able account as long as the person does not have a representative payee. When a person dies, if the person is younger than 55, actually, let me back up a step. When a person dies in Pennsylvania, the state does look at a person's assets and their estate if the person with a disability is older than 55. The Pennsylvania Department of Human Services can make a claim for services given after the person's 55th birthday, specifically for services, home and community-based services, hospital services, and prescription drug services. If the person passes away before age 55, there is no claim made against the estate. So that is a federal requirement, and we're lucky in Pennsylvania that our state only looks at expenses after the person turned 55 years old. Many states don't have that limitation. And that rule is true whether or not someone has an ABLE account, so no one's penalized for having ABLE. So any assets that are left over after that process would be passed out according to the person's will. So that pretty much is a summary of what happens.
So it doesn't matter if you, if it's like SSI funds versus SSDI funds that could have been off your own work record?
So when a person passes away, the state can make a claim against their assets, all kinds of assets, a house, a car, a diamond ring, anything. I don't think there is any differentiation on where those funds came from. And the state could use those to offset any funds that the state spent on certain types of benefits given to that person after they turn 55.
Okay, like meaning if they had Medicaid and they use, like they paid.
Yes.
Okay.
Yep.
Okay, thank you.
Sure.
All right, so next we have Mary Lou. Mary Lou, you should be able to unmute yourself.
Question I have is about SSI. If a parent retires, how does that affect the adult with a disability that receives SSI? Is there any impact on that?
That is a great question. And it goes to the Social Security program a little bit more than it does supplemental security income, from the standpoint that an individual that is what we call a disabled adult child, or an individual that might have had a disability since prior to age 22, might potentially be eligible to collect off of that parent's retirement record. And that's a major screening question that we have when we take retirement applications. So let's use your example that a parent of an individual that's receiving supplemental security income goes and files for their own benefits, is screened. If we can find that the disability had occurred previous to age 22, they had not worked substantially at any point in their lifetime, and they had not gotten married, they potentially could start to collect off of that retirement record, the parent's retirement record. Now, number one, the primary on that record does not see any reductions to benefits, much like if they have a spouse or even a widow that would be collecting off of their benefit. And then from that standpoint, in some cases, an individual will transition to that record. The advantages of collecting benefits as a disabled adult child versus getting supplemental security income is that there are no income and resource limits for collecting those benefits. Now, there are certain qualifications as far as work is concerned. So working at a certain level could jeopardize benefits, but how much a person has in the bank or other factors of income would not reduce the amount that they receive off of that individual's retirement record. So that is one potential implication as it relates to supplemental security income. As long as the individual otherwise is over age 18, the income and resources of the parents should not affect that person's benefits in any type of way. I hope that answered your question.
Thank you. Yes, I appreciate that.
All right, thank you. Now it looks like we have a question from, I believe it's Michelle. You should be able to unmute yourself.
Hello?
Yep, we can hear
Oh,
you.
all right. I have two questions. The first one's probably a pretty clear cut answer, but if I have money in a Pennsylvania TAP account and I want to now transfer it into a PA ABLE account, I don't believe there would be any tax consequences to that, but am I limited on how much can be transferred each year?
Hi. Yeah, you can move money from a PA 529, excuse me, a 529 college and career savings account into an ABLE account. You can roll that over with no tax implications. You are limited by the $17,000 limit on what an ABLE account can accept this calendar year. So if I had a 529 account, say that had $50,000 in it, I would need to roll it over a few years because of that $17,000 limit.
And that would go by the value of what it's currently assessed at, correct?
Yes.
Okay, because yeah, it's assessed probably above the 17,000 now, but when I put it in, it wasn't that much. Okay, so the current value. Okay. The second question I have, and I totally don't know anything about this. What exactly is the waiver funding program? And is that something that varies by each county within Pennsylvania?
That would be something that I don't think Frank or I would be expert enough to answer.
Okay. Do you know what category, who I can reach out to maybe get that information?
I would think the Department of Human Services.
Okay, and that's by county, depending on what county you're in, correct?
Again, I'm not really an
Okay.
expert on that. I
Okay.
apologize.
That's all right. At least I got a lead. Thank you.
All right. Not seeing any other questions. I'd like to thank everyone for joining us today, and I hope you all have a wonderful rest of your day.
Thank you.
Take care, everybody.